My name's Jay, and I am a physical therapist with a specialty in pulmonary therapy. And I want to talk today as part of virtual care, which is an online program that provides exercises and education for people from a clinician's standpoint that's been created from a clinician and also presented from a clinician. That's virtual care with a K, K-A-R-E. And what we're going to do today is to do exercises that will help you not only if you have COVID or if you've gotten over COVID, but also with the anxiety associated with everything that's been going on. So we know that deep breathing helps with relaxation, but we also know that deep breathing helps to fill your lungs. And when it can fill your lungs fully, you can get better oxygenation. When you get better oxygenation and you breathe out, you can breathe out all of the carbon dioxide that's stored in your lungs. So you're really cleansing your lungs in both directions. Not only are you doing that, but if you are finding that you're junky and you're congested and you're having trouble getting rid of your secretions, not only should you be drinking well unless you're on a fluid restriction, but you should also be taking a deep breath in, because that's going to help you to force those secretions out. So you really want to take that deep breath in, not only to get the air in, but to get the secretions out. Once your airways are clear, you're going to breathe better. And you're going to find that this is going to help you not only just with sitting still, but if you're going to get up and try to do anything, you're going to find you're going to be less tired. You're going to find it's a little bit easier if you can breathe fully when you're doing your activity. So what we want to talk today about is in stages. The first stage we're going to talk about is just how we breathe normally, and just two techniques that you'll find are used in almost every activity. You'll see it in yoga, you'll see it in any exercise program, you'll see it in relaxation. But with COVID, what we're really trying to do is to, again, get really good oxygenation to all areas of the lungs, and also to get rid of any secretions that we may have that's affecting our ability to get good air exchange. So what I want you to do to start is just to find a nice, quiet, comfortable place to sit. You can either sit back in a chair, or if you feel that you're having trouble sitting, you can lay down. But when you lay down, have your head up a little bit so it's a little bit easier to breathe. What we're going to start with is just closing our eyes and just feeling how we are breathing. So I want you to pay attention to what's happening with your neck and your shoulders, what's happening in your rib cage. Is your belly moving? Is it fast? Is it slow? Is it rhythmic, meaning is it the same each time? So just close your eyes and just get a feel for how are you breathing. You can put your hands over your upper chest wall or your lower chest wall and see if you can feel where the air is coming from. But just try to relax and just comfortably breathe how you normally are breathing. And what I want you to be paying attention to is, do you feel tension in your neck? Or do you feel your shoulders moving? Do you feel your rib cage and your belly filling up? Or do you feel most of it coming from your upper chest? Okay, is it nice and rhythmic? Is it the same each time? Is it very brief when you take a breath in? Or do you feel like you're getting a couple of counts where you can breathe in and you're counting at least to 2 or 3 before you breathe out? Okay, so now you can open your eyes, and what you know now is what you're breathing like right now. So let's talk a little bit about how you want to be breathing. Whether or not you're sitting, standing, or moving, you want most of your breathing to be coming from your belly. And that means that you're using the muscle that's underneath your diaphragm and the muscles in between your rib cage to expand your ribs. Again, you're trying to get nice air, good breathing, so that you can not only get good oxygen exchange that may be limiting you right now during COVID, but you also want to be able to get rid of any secretions and anything that's in there that's affecting your ability to get good air exchange because it's clogging your airways. It may even be down at the very bases of your lungs. With pneumonia, you'll find that you'll feel it more in the bases of your lungs. But again, if you don't open up those airways and really get them open, they collapse and they get difficult and they get infected. So we really want to open them up all the way, as much as we can, and then really try to get all the air out also. So we're going to start now with just feeling, where is my diaphragm? Okay, so the diaphragm is a big, flat, slightly arched muscle, and it's located right here, actually. And when you breathe in, it goes down and it pushes your belly contents out. And that's why your belly goes out. A lot of people never really get to the point where their breathing is down here. And if you're feeling short of breath, it may take a while before you can get that breathing where you can feel it coming, where it's going down to your belly. But practice really helps. It helps you to really not only learn to control your breathing, but to get a more full breath. And you start to feel what you should be using to breathe with. So when you sniff in with your nose, what you feel is your diaphragm starting to jerk a little bit. And that's because it's a big muscle that you're using when you sniff in. So this is where you want to be breathing from. Most of your air should be coming from the action of your diaphragm and the muscles between your rib cage. And when you do that, what you'll find is your belly goes out and your rib cage starts to expand this way as well. So before we get started, what I want to do is make sure everybody understands what rescue breathing is. And that is, if you're feeling short of breath, this is the position that you want to get into to get your breath back. Okay, so you want to try to relax and not get too anxious, but you want to either put your hands and your forearms over on your thighs and lean forward and just try to relax and take some breaths this way. And ultimately, you can also lean on a counter and do the same thing. And what you're doing is anchoring so that you're using your body to work on breathing only. Our diaphragm works on our posture as well. So if these breathing exercises are hard, what I want you to do is to start with yourself reclined back at the very least. Even if you're sitting upright, sit back a little bit. And you do this because now your belly, your diaphragm is only working on your breathing. It doesn't have to work on your posture as well. So what we're going to start with is pursed lip breathing. And this is the breathing way that you should be breathing most any time. And this also is when you're doing any of the other techniques. And pursed lip breathing is also got a mnemonic to it. And what it's called is smell the roses, breathe in through your nose, and blow out the candles, which is slightly pursing your lips as if you're going to blow out a candle. Okay, so we're going to practice this. And again, it takes a while for this to become something automatic. And if during COVID, you're having effects of your lungs, you're going to have more difficulty trying to control this because anxiety starts to take over. So if you're only doing this and getting relaxation out of it, that's worth its weight in gold. But what we really want to do is to teach you how to breathe properly so that you're efficient and you're getting as much oxygen as you need and you're getting rid of the rest of the contents of the carbon dioxide so that next breath in will be nice and full. So what I want you to do is to find a reclined place to sit back, close your eyes. I'm going to turn to the side so you can see a little bit about what's going on otherwise. But mostly what I want you to do is to pay attention that my air is coming in my nose and I'm blowing it out my mouth. So it's in and out. I'm trying to breathe in on a count of 2 and out on a count of 4. I want to give myself enough time to get all of the carbon dioxide out of my lungs so that I can get that next breath in. So I want you to close your eyes and just visualize what it feels like when the air is going in your nose and out your mouth with your lips slightly pursed. We're going to do this 10 times. So in and out. Really try to let your body relax and force all the air out. In and out. In and out. Try not to force it too much. Just let your body muscles recoil back and relax down and push the air out. So in and out. In and out. Try to make this nice and rhythmic. In and out. In and out. Hopefully you're starting to feel your body start to relax a little bit. In and out. And in, out, in, out, and in, and out. Again, this, if it does nothing else, is going to help you relax. When you relax, you're going to be more inclined to take a nice deep breath. One of the worst feelings is a feeling that you can't breathe, and that brings a lot of anxiety. Just the fact that you have COVID can be anxious. The fact that people around you have COVID can also make you anxious. And certainly if you're affected by the COVID, you're feeling the effects of it, possibly affecting the muscles that are affecting your ability to breathe. So we're trying to direct the muscles that are responsible for breathing, the diaphragm and the muscles between your rib cage, to really open up and fill your lungs fully so that air gets all the way to the bases of your lungs and in the back as well, filling up all of your airways, getting good oxygenation, and then being able to just slowly relax and let the air just force out of your body. The next type of exercise that we're going to talk about is called diaphragmatic or belly breathing. And it's belly breathing or diaphragmatic breathing because that's exactly where you're working on, is you're working on your diaphragm, the most important muscle in your body for breathing, that is acting every second of the time that you're alive, to work on taking a deep breath in and pulling that air in, which forces the contents of your belly out. And then as it relaxes, it pushes that air back out again. So again, I'm going to turn to the side, and I want you to lie back a little bit and put one hand over the top of your chest and one right under your breastbone, and really just right over the top of your belly. When you take a deep breath in properly, you should feel the hand up here moving, and very little movement coming from here and nothing from your shoulders. when you have difficulty breathing, you start to strain and start to use all these extra muscles to help you breathe. But the problem is they can't fill your lungs properly. So that's why it's so important to not only relax, but to really focus on where are you getting your air from? What work are you doing, and what muscles are you using? So again, you can use these, but they're not efficient, and it's very tiring. And not only that, but you're not getting good air down to your lungs. So you're not getting the oxygen that you need. And in fact, not only getting the oxygen, you're not getting the oxygen that you need, you're not getting enough of an air in to really push out any secretions that you may have to clear your airways. So we really need to do both. So I want you to lean back with your eyes closed and one hand over the upper chest and one over your belly. And just feel where you feel the movement to start. Just breathe normally. And if you're not breathing deeply, you're going to feel more of the movement coming from this upper part of your body, meaning that you're filling part of your lungs, but you're not getting down to the rest of your lungs. So we want to lean back a little bit and see if we can visualize trying to push the air down to the bottom hand on the belly and make that belly come up when you breathe in. So you take a deep breath in, and just, even if you can't do it, just try to picture the air going down and pushing your hand out slightly. This may be something that takes a while for many of you, and that's okay. And if you are short of breath, this may take even longer because it's scary to actually spend that time to breathe when you feel like you got to get that next breath. But it is critical that you learn to breathe deeply and fully. So you're going to close your eyes, recline back, and see on the count of 10, we're going to do 10 repetitions of trying to bring that air into our belly. So deep breath in. Hopefully your belly's coming out and out. And your hand should come down. Don't get frustrated if this isn't something that you can do quite right away. You will get this. It just takes a while for some people, and it just matters that you practice. So deep breath in and out. In. Out. See if you can quiet that upper part of your body. In and out. In. Think of your lungs like a balloon, trying to fill them up fully. In. Out. In. Out. More times. In. Out. In. Out. One last time. In. Out. So I don't want you to get frustrated if you can't do this. Some people, it takes a lot of time before they really get it. And that's really all that's important, is that you finally get it. Everybody's diaphragm works unless you've got a spinal cord injury. And so we know that the diaphragm works and the muscles on the sides of your rib cage work, but you may have forgotten how to use them or use them effectively. So we want to teach you again how to strengthen these muscles that are so important for you to take a deep breath in and force out any contents that are in your lungs or airways that you don't want. Now, if you can get the habit of being able to breathe in with your belly, then you want to try to coordinate that with the breathing in with your nose and out through your mouth. So when you're taking a breath in, it's still through your nose. And when you blow out, it's through your mouth. but then your belly is moving at the same time. Now, this is not something that everybody gets right away. It's very, very difficult for people that are short of breath. It's okay that you're just practicing and you're not getting it, because just the practicing alone, you're getting some strengthening and you're teaching the muscles that are responsible for breathing how to do their job. The more strength that you get, the more efficient you're going to be at breathing and the easier it's going to be to breathe. Once you're having an easier time breathing, you're going to find those other activities that you're trying to do that you can't do to be much easier. So it's very important that you understand that this isn't something that everybody gets right away, and that's okay. It's important that you're practicing, and you want to practice twice a day for a few minutes. And if you're getting frustrated, I suggest you just stop and rest and come back to it a little bit later. Make sure that you're in a quiet room. Some people do well with some soothing music, but try not to have any distractions so your focus is all on your breathing. Once you get to the point where you can do this, when you're trying to do it, you'll find that over time you can do this without even trying. And then you'll be able to start getting up and doing things and not focusing so much on your breathing. And your breathing is actually helping you to perform the activity. So even though you may not be able to do this right now, this will be something that you'll be able to do as you get better. This will be something that you will maybe need to do consciously for right now and pay attention to. But as you get better at it, you will find this will become natural again. And it will go back to breathing the way that you used to breathe. So again, even if it does nothing else but help you to relax, that's important. So relaxation is important for you to know to focus on the breathing muscles that you need to breathe with. So the last thing we're going to do today is to talk about breathing and how it affects your rib cage coming out this way. Now you have muscles between your rib cage, and they're responsible for stretching out and helping to expand your rib cage. So again, all of your lungs can get expanded down to the little airways, fill with air, get good oxygen, and then come back out. So I'm going to have you put your hands on the sides of your rib cage. If it's difficult to do this, you can do one at a time. You can also do it like this with your arms crossed, whatever is easier for you. But I want you to, again, lay back a little bit. And I want you to focus and see if you can get your air so that you feel that your hands are pushing out. Okay, and again, this isn't something maybe that you'll get right away. Maybe you're not taking a deep enough breath to get that happening yet, but don't stress. Just try to relax and focus your breathing. Okay, so we're going to close our eyes and we're going to do 10 counts of breathing in and out. And just rest your hands comfortably and see if you can feel them moving out. In and out. In and out. Again, don't get frustrated if this is something that you can do right away. In and out. In and out. Go at your own pace. In and out. In and out. In and out. One last time. In and out. So these are activities that you want to practice. It's okay to practice more than twice a day, but make sure you practice at least twice during the day, once in the morning and once in the evening, and space it out a little bit. Again, it's so important for you to take a nice deep breath. The effects of COVID affect a lot of our lungs. They just affect our ability to just generally be able to do things because we're deconditioned. And so we need to strengthen our muscles. And one of the most important muscles to strengthen are the muscles that are responsible for breathing, your diaphragm and your rib cage. So I hope this was helpful. And I look forward to working with you again, and have a great day.